The membership tag continues to meet, and as we've been discussing a bunch of other times, the OD leave behind kits were discussed. It appears to be successful, about 10 to 15 per day. 2 kits are get distributed. Approximately 20% refuse the kits. They're free. They require registration, and as Nancy said, REMSCO has free kits for distribution. The next meeting on this minutes was to be held on November 13th, which surprisingly I have those minutes too.
Yeah, that's right.
All right.
What a man.
Moving right along. Okay, so this meeting was held on November 13th. From a membership standpoint, REMAC is seeking RNs for membership on the QA committee. So if there are any RNs who were just recently, like tonight, appointed to this committee, who might be interested in participating in our quality assurance committee, please let me know.
I nominate her.
The bylaws are still being reviewed. There was a discussion about the pediatric epinephrine dosing that is in the check and inject kits. Thank you. Apparently, the syringe, which is graduated to 2 levels, one for adult, one for peds, gives a peds dosing that for very small pediatric patients is too big of a dose. So the FDA is questioning whether Boundtree can sell those kits or release those kits and those syringes. We're still waiting on a little bit of direction before we decide what to do on a
Just as a point of information, Boundtree,
Go ahead.
the FDA recall, and they sent to the agencies new syringes.
Correct.
Since that time.
Right.
But what are the new syringes?
They're regular 1cc.
Regular
Syringes.
1cc.
Right, so the regular 1cc syringes, that's out of the scope, unfortunately, for BLS, that's not right.
Yeah, it is.
No, it's not.
Yes, it is.
To
It is.
measure
You
their
can't do
own-
the, BLS can't do the calculations.
Yes.
It's not.
The State Department of Health said in an email, and I'll send it to you, that it's out of the scope of practice.
Well,
And that's what we have to
the
follow.
state
It's an
disagrees
off-label
with you,
use.
so if the state wants to agree with you, that's fine, but right now they don't.
I'm gonna
So the state says they call the state. But currently, that is a problem because it is out of the scope as per the state.
All right, just for clarification, for
We had a point of information, now we have a point of clarification.
Yes.
child under 33 pounds, can we administer epi to?
Well, again, it's not a matter of administering the epi, right? Somebody who can calculate the dose can administer epi to anybody at the right dosing. The problem is that an EMT is not allowed to calculate a drug dose. So that's why we have the check and inject syringe, which has 2 doses on it, and it doesn't have to calculate anything. You just pull to here or pull to here. The problem is the calculations, which is where we run into an issue.
But the EpiPens themselves, they can only be used on EpiPen Junior, 33 pounds and above.
I believe that's the recommendation from the FDA.
Yeah, otherwise you're overdosing.
Which is not right now reflected in our protocol as we are working.
We're just
That's our problem.
figuring out a little direction. So we'll have an answer for you shortly. Okay, from DOH, the following public notice was read into the minutes. Juan Rosado, EMT number 338975, was assessed a $2,000 civil penalty for violation of 800.3, and he resides in Flushing County. The measles outbreak was discussed. It requires standard exposure protocol, and that REMAC should be advocating for EMS. That's a helpful thing to do.
So that's-
Paramedic exam was discussed, so this is fun. The pass rate is 85%, and the exam is being carefully reviewed for content and statisticians. There was a discussion about what the state does with their exam and who validates their exam, and so on. The protocols, let's see what else we got. Medical director credentialing and CME. So the certification credentialing committee will ensure that all ALS medical directors meet the criteria which was set by REMAC in 2016. So there is criteria for this. They will ensure that medical directors are meeting it. And the certification credentialing committee, as well as the T&E committee, will discuss how CMEs will be appropriately reviewed and approved for the hours that they have on them. And CME flyers will have to include a standard set of components. And that concludes the REMAC reports for October, November.
Thank you. Are
Does
there
anybody
any
have any
questions? Dr. Schenk? Hearing no questions, I'll call upon you a second time,
Thank you.
okay, for the Quality Improvement Committee report.
Okay. Let's start with October. Alrighty, so we're gonna do this one hopefully a little quicker. So, we're gonna be doing a Narcan study for our QA, our regional QA study that needs to be submitted to the Department of Health. There's no new information on the midazolam study. We will be looking at safety and fatigue, and developing recommendations for that. We are requesting QA information from the mobile stroke unit, and the membership was reviewed, and there was a request to REMSCO, this is from the QA committee in October, a request to REMSCO to nominate and seat an RN to the QA membership. So if there is an RN who we might have nominated to this committee tonight, who could possibly, anyway.
Okay, so the nomination has come from me and you
Yes, sir.
together. So we will meet right after this meeting, like, as soon as we
Discuss
adjourn,
it.
and choose somebody,
Right. Okay,
assuming that somebody agrees.
yes. We'll choose somebody who wants to do it. Okay.
People have a choice.
You don't, other people do.
Okay, I want to go home.
All right, so here we go. All right, so the stroke systems of care draft was discussed. Again, this is a little bit outdated. There is a First Watch Mission Lifeline QA project that is a grant that is for the 911 system, and hopefully that will grow into a larger QA tool for the region. And the next meeting was on November 8th at 4 PM via conference call, which I happen to have for you. So this meeting met on November 8th via conference call. And membership was discussed again. The possibility of a nursing position was discussed. FDNY is being asked about possible EMTs that could participate. There were 2 PCRs, appeals that were, so this is patient care restrictions, not anything else, but that were received, and there will be interviews in the future. A stroke letter was sent out to the entire region, to the hospitals in the region by Greater New York. Just doing us a favor because their list was more up to date. And this letter, it was requesting from hospitals to voluntarily participate in our LVO program. So that now that we have LVO centers, thrombectomy centers, and so on, hospitals were asked if they would be willing to provide 24/7 coverage for large vessel occlusions. And that those replies are coming in. We've gotten, I believe, 22 at last count. So we're almost all the way there. Once we have the full list, like I said, the implementation date will be April 1st of 2019. The safety okay, First Watch we discussed. There's really nothing more to add. The next meeting will be on we moved to December 11th, I believe, right? December 11th, here at the Interchurch Center. And
Any
that
questions
concludes
for
the
Dr.
quality
Schenker?
assurance report.
Are there any questions for Dr. Schenker? Thank you very much, well done. Okay, I will now give the REMSCO report. The REMSCO met on September 25th and 26th. I was not there for September 25th, it was a Jewish holiday, so I will rely on some of the notes that I was given. The highlights are that the REMSCO bylaws are being revised, and I find myself as a member of that committee. As you know, REMSCO meets only 3 times a year, but from now on, subcommittees can meet 6 times per year, an additional 3 times remotely, so that in addition to the 3 times that REMSCO meets, the subcommittees can meet 3 times additionally, okay, and this will be implemented for REMSCO and for CMAC. The 2014-15 trauma data report will be released in October. Since October has passed, has anyone seen this? That's the school president release. Okay, so it will not be released. The opioid report will be released by the end of the year. The end of the year has not yet occurred, but when it is released, it should be reviewed. Okay, the New York State Department of Health will create a newsletter to keep the regions updated. So there's going to be a nice new shiny color newsletter coming out.
What color?
I don't know.
Shiny.
Okay. The CME recertification program is being revised and will be rolled out at the end of the year. There have been various changes to the DOH staff. Various people have left. Following the motions, the New York City ALS protocols were approved. The NYPD ESU ALS tactical protocols were approved with minor changes. Transmucosal fentanyl administration is up to individual REMACs. Fentanyl is already on formulary, and therefore the alternate route was approved. Okay, now comes a little story. So many of you may know that the state has been working for many years to allow agencies to transport patients with blood transfusions in place. This was a multi-year process. They had to go through the governor's office, they had to go through various committees, and after about 3 or 4 years of a drawn-out process, it was finally approved. Lo and behold, a new agency showed up
Not a
at,
new agency. Not a new agency, it's just new to us.
as I was getting ready to say, new to us,
New to us. There you go.
okay,
It's new to you.
and said, you are all in violations of our agency's guidelines, and you may not transport patients with blood transfusions unless you follow our rather onerous requirements, which I will not spell out right now, but they were very, very long. This agency sent 2 young ladies to present this to the CMAC, and let me put it mildly, I understand that they were shell-shocked by the time they walked out because the physicians attacked them and their agency quite mightily, and they were quite upset.
CMAC was very unprofessional.
And CMAC was, at least they said that CMAC
They
was
said.
very unprofessional. And so they came the next morning to my committee, to the systems committee, and repeated everything that they told the CMAC the day before and asked us and begged us to please not yell at them and to please act more professionals than the doctors. And we said, okay, we'll listen to you. And we listened, and we then told them once again how this will not be well received. So they came a 3rd time, this time to the REMSCO, and we told them at that point, we all heard this already 2 times, okay, please do not repeat the story again, because they had a long slide presentation which said everything that we need to do, which we haven't done. And we just simply said to them, do you have any questions? In any event, the REMAC and the CMAC passed the following motion. As written, the ATS regulations impede clinically appropriate emergency medical care. We implore the Commissioner that there should be a moratorium on any personnel or hospital emergency enforcement pending the establishment of a committee made up of the department, blood and tissue committee members, CMAC members, and hospital representatives to review the implementation of the ATS regulations. During this time, existing patients may be transported with appropriate personnel. This was passed unanimously, and it went to the Commissioner. Now, I heard a rumor that the Commissioner said okay. I asked you to find out whether, in fact, he did say okay. That he stayed there, the ATS regulations, and said that things can go on as usual. Does anybody know? Okay, I'll ask you again to please ask the DOH.
Let me ask you a better question. What is the as usual?
So the what?
You said things can go on as usual. What is the as usual? As usual, sorry.
And the original permission to allow agents, BLS and the AA,
BLS and ALS cannot transport blood transfusions.
they say they can, but no, there
Who's
was
they?
the AT, this group, the
If you've gone
lab.
through the process.
Right, but the.
So everybody else can't.
What?
If you have not gone through the process of becoming an ambulance transfusion service,
Right.
you cannot
You
transport blood.
cannot. And they asked the commissioner to put a stay on that and to allow them to continue to, as originally was approved. Remember, there was an original approval.
Wadsworth, you say. When you say allow them to proceed,
No. Wadsworth is the bad guys here.
let's not call bad guys good
Okay,
guys.
Wadsworth
Let's
said
talk
you
the facts.
can't do it. But the state had originally approved, after 4 years, to allow agencies to transport patients with blood transfusions in place.
As
Period.
long as they've gone through the process of becoming an ATS.
Not Wadsworth's process.
It was the DOH
DOH
process.
It was a
using
DOH
Wadsworth's
process. It was a DOH process, not Wadsworth's process.
It's different from what these new,
Right.
this group says has to be
I
done.
don't think it is. I think that the process is a very painful process.
That's the
But that's what
Wadsworth process.
the Department of Health is basically told Wadsworth, what is your, how are we gonna do this? How should we do this? So if you go to the Department of Health and you wanna become an ambulance transfusion service, the process is Wadsworth's process. So if you say that there was a stay on what? Meaning, can you transport if you are an ambulance transfusion service, and if you're not, you can't transport blood products?
I assume that if you are already
Don't assume.
approved by Wadsworth, you can certainly continue to transport. No one's telling them you should stop
So
transporting.
Wadsworth, just so you understand, Wadsworth is basically contracted by the Department of Health to provide laboratory services for the entire New York State CLEA program.
Right.
That's Wadsworth's role and where they fit in.
Right.
Okay, so when the Department of Health went and said ambulances can transfuse blood, they went to Wadsworth as the person who runs blood banks and said, how do we do this? They came back with a process, which is a long, tedious process. You guys just saw the process, because Wadsworth presented it, but for those of us who've been through it and literally have to go to every institution,
It's
it's
a
a
horror.
pain in the butt.
Right.
So, my question to you is, this letter that went to the commissioner that possibly or may have gotten approved, what is it, how does it change anything? What does it mean?
My understanding was, and maybe I'm misunderstanding, was that you would be able, without going through this process, you'd be able to move patients with blood transfusions in place.
So,
Period.
but before
Just as
the
you can now
process-
do ordinary IVs, you'd be able to do the same thing with no extra work. However, right now you can't.
So,
And the
that
question
doesn't make
was-
sense, because before the ambulance transfusion process, ambulances were not allowed to transport blood products.
But they did.
They did upstate, so in other counties, they were transporting
doing
anyway.
All over the place, because once they got the approval from the state, through the governor's office to do it, they were doing it all over upstate.
It was primarily
Okay, and
So people were doing it without any approval, and now they went through the approval process, they didn't like the approval process, and now they're saying, let's go back to no approval process. Am I getting it right?
basically.
Okay, thank you.
Because the
That's all I
claim
wanted
is
to
that
know.
upstate, patients are gonna die because they are found in small hospitals. You
Okay.
cannot deal with trauma patients, and the small hospital's gonna wanna move the patients to a trauma center, and they're gonna call up the local agent, BLS or ALS EMTs out there, and they're gonna refuse to transport them because they're not allowed to according to this, and the patient will die in these small little hospitals where there might not even be a doctor in the emergency room.
But giving them wrong blood and not having a process to check it.
Well, again, that is the issue, okay?
I'm just curious.
So I don't know what the commissioner said, and I asked last time that we should,
Moratorium on enforcement.
I asked before if the
If you
commissioner.
start blood in the ER,
Yes.
you need to get the patient out. It's not starting blood in
I
the field.
think part of it is we
Yeah,
need
it has nothing to do with
clarification
starting blood
on
in the
that.
field. Absolutely
But
nothing.
what I believe the circumstances were, and correct me if I'm wrong, Dr. Shanker, is right now, the ATS process
Yeah,
is
it
in
said no
agreement
nurse.
with each
If you wanna say
facility
Yes.
that
Correct.
this piece absolves getting it from each
Enforcement.
facility.
Enforcement.
It gives you a global ATS based on meeting
If
a
you go
process
through
versus.
the
each-
ATS process, you are now ATS approved for any facility wherever you go.
So,
Is that what
I
you're
think-
saying?
I
'Cause
think
I
that's
would
what
love to
they're
see that in
trying.
writing.
I
That
think
makes
the bottom
life
line
a
is,
lot easier.
we should find out, I think the bottom line is we have to find out what the commissioner said,
That's right.
and what is gonna happen. We don't know this, so I have no idea.
My only confusion was, you said there's a moratorium on the process, and then I just was not sure if you could just, anybody can transport blood, or what the rule
We
is.
don't know. That's the point. We don't know.
I'll take it.
But upstate, they're really in a panic over this. Now, by now, the commissioner certainly should have said something, because this was in September, and we're now in the end of November, and if it,
We have
so
to
they
ask.
must have said something, even if it hasn't filtered down to New York City yet,
I'll find out tomorrow.
and send out an email to Dr. Schenker, who's really concerned, and to the
I'm
rest
not
of us.
concerned, I just wanna know what I'm supposed to do.
Okay, let me move right along. That was the exciting part of the meeting
Oh, good.
over 2 days, one of which I wasn't there for, and the day I was
Thank
there.
God.
Okay, and there were various motions about budgets and stuff, which I won't bother you with.
Budgets aren't important.
Well, since you don't get to spend the money, they're not important. The next CMAC SEMSCO meeting will be held on January 15th and 16th in Troy, New York. And I will not be there, and my alternate will be there. Unless you got already. No, Dr. Krupi has not yet been. You're gonna go. You haven't yet been fingerprinted and all that stuff. So officially, Nancy will continue to be the alternate, and I won't be there. And you're gonna go there anyway, just to listen into the fun. And hopefully by some point between January and the next time they may, you'll probably finally be vetted, and then you'll go as the representative, and I'll go as the alternate. And that concludes my report. Are there any questions on the SEMSCO report? Hearing none, we now move to unfinished business. I'm not aware of any unfinished business, but because Marie does not want us to go home yet, she has some new business for us.
She doesn't.
Yes? Okay, listen, the meeting is about twice as long as the other meetings that I handle, because we have to make up for 2 meetings. Show up at meetings, and we'll try to keep our meetings at a little bit plus a half an hour.
We were here the last time.
I know, I'm yelling at all the people who are not here, and I'm not looking at you.
If
You're
you
looking
guys
at
would
us
stop
and yelling at
arguing.
everybody else.
Cover your eyes.
If I cover my eyes, then you can't see me.
Right, dude, you got it.
If I cover my eyes, then you can't see me.
If you cover that, then.
Go ahead, Nancy. I mean,
Marie, okay.
Holidays.
Hello.
Hello.
In an effort to, don't rag me. An effort to try and get council members to participate more, because really this is your committee. And we'd like to see you involved and actually making decisions on how the region is run. I asked Dr. Langston, the chair, if I could make a few suggestions. One of the things that we in the office thought would be a good idea is to create a disaster preparedness tag out of this committee. It would involve REMSCO members as decision makers, since you're our expert resources in EMS. We want you to assist in the development of initiatives and identify items that we perhaps, put in grants for communications needs. I attend the Staten Island disaster meetings. Staten Island is where I live, and with Sandy, they were cut off, and so they decided at that time that they wanted to set up like mini OEM for themselves, just to figure out what resources they have on Staten Island in case they get cut off again from something else. And they're complaining about lack of communication resources, which I think is still a problem here. Also, I spoke to a few other EMS agency leaders who were talking about they need more bunker gear, turnout gear, and other items, things that only people from EMS agencies can tell us that you need. And we're in the office, we're out as much as we can be, but we need people that are in the field to give us real-time information. So I'm hoping that we get some volunteers. Well, if
so
we
the
decide
way
to
we're
do
going
this.
to proceed, if you're going to send out an email to all the members of the REMSCO, listing the various tags and committees that we want to form, and we're going to ask you to volunteer for one or more of those committees. Okay, if we will then hopefully have enough people who are interested in working on these things. And at the next meeting, hopefully we'll be able to report that we have standing committees with who is on each of them. So when you get this email, please vote generously, contribute, and your time, okay, to work on these very important ideas. It's really meant to empower the REMSCO members to do this work.
And,
And most of, I'm sorry, and most of these meetings would be virtual. These are not in-person meetings. This is stuff that we can do through our Adobe Connect, through conference calls, and various electronic means. So what it would require is you're sharing your ideas with us so that we can compile what will make things work and function and help you do your job better.
In other words, being on REMSCO is not just fun and games. You gotta do some work as well.
yeah, it would really
So thank
help
you.
us. I mean, in our office, I don't know how many people have gone upstairs, but there are 5 of us. That's it. So when you ask for us to do things, you're really just asking me or Nancy, maybe Dina or Joe, and we all have our plates full. We want to do things for council, but we really need you to be actively involved. One of the other things we really need help with is we have a REMSCO desk at OEM. When we get activated, there are like 3 of us that can go up there. We need to create a team of people on this council, or if you know other people who maybe are retired or have more flexible schedules that they're not going to be, I know most of you work for agencies that if there's a disaster, your time is theirs. But maybe you know other people who have EMS background who would be interested in helping us and going to OEM for the training so that you can help us staff our desk. So it's something for you to think about.
Okay, so this email will go out within a day or so. Please put your name on one or more of these committees, and hopefully we'll have enough people, volunteers, so that we can formally announce it at the next meeting.
And
Are there
that's
any
all.
questions? Thank you very much for excellent idea. Any other new business? Yes.
Yes. For those of you who are not aware, the Stadium SC program applied for a small grant to seek funds to support the development of a cadre of pediatric emergency care coordinators for every ambulance service in New York State. The scientific evidence behind this strongly suggests that the presence of a pediatric emergency care coordinator within every ambulance service improves the quality of pediatric care, ensures that pediatric CME is offered on a regular basis, and so on, all things pediatric. So this initiative is getting off the ground very shortly, but the end result is going to be that the state is going to request that every ambulance service identify an individual as a pediatric emergency care coordinator to assume the responsibility of ensuring that the needs of the children are met within the system insofar as ambulance issues are concerned. There'll be more about this as time goes by. I sit on that committee as chair of the Stadium SC committee. Marie is also representing us, I believe, on that committee. The responsibilities of the pediatric emergency care coordinator are not expected to be onerous, but they are expected to be, responsibilities that will be met because that's what the kids need. We'll be giving you regular reports as we learn more.
Thank you very much.
Dr. Cooper,
Sir.
is this tied in at all with the Pediatric Disaster Coalition?
Not explicitly, no. Certainly disaster preparedness is one of the issues that will be considered as something that pediatric emergency care coordinators will need to be participating in.
Thank you. Nancy, you had something else?
Yeah, I just want to end with, for those of you who may not have, I might not have introduced Mary Ann Salas. Mary Ann, you may not have, were here, if you weren't here in that meeting, that none of you attended that. Mary Ann was here, and so Mary Ann is going to be my successor, so I want you to
know who she be.
Welcome again.
Thank you.
Okay, before I entertain a motion to adjourn, I just want to wish everyone
We just have one
still
more
not
thing.
going home, go ahead.
Over the last week, the EMS community lost 2 members. One EMT, Joseph Rodriguez from the fire department, and paramedic Martha Stewart from NYU Langone, and retired from FDNY. I just asked the committee to recognize them and have a moment of silence.
Thank you very much for raising attention. Have a moment of silence. Thank you very much. Thank you for reminding us. So before we have a motion to adjourn, I didn't recognize you yet, be quiet. I want to wish everyone a happy holiday or vacation or whatever you celebrate or don't in the next month, and we will see you next sometime back in January. Now,
Hold on. I
you
just
really
want-
don't want us to go home.
I just want everyone to recognize that Nancy is retiring, and this may be her last REMSCO meeting, though maybe not, but thank you very much for many, many years of service.
Okay,
Why would you?
relax.
Motion to adjourn.
Thank you.
Thank you.
You adjourn.